What's up, guys? I am here today with Dr. Michal. She is our newest doctor on the Sanare Functional Medicine team. We are so thrilled to have her here. Welcome, Dr. Michal.
Thank you. It's so good to be here.
So we have a lot of people who are excited to see you, but I think, guys, a natural tendency whenever there's a new doc in a practice is to wonder, like, who are they? What do they stand for? Like, are we going to mesh and fit? And so, Dr. Michal, I just wanted to give you a minute to tell people who you are and what matters to you, and importantly, like the approach that you take with folks one-on-one in appointments. What do they need to know?
Yes, absolutely. I think that I'm a great doctor for people who don't like doctors, in the sense that I think that I have a really great colleagues in conventional medicine, absolutely. And also, I think sometimes people need to really feel heard and respected and have the time to talk through and have their own instinct or intuition listened to, respected, have time for that. And so, very much I'm interested in what matters to me is what matters to you, and what you want to be doing in your life, what you want to be contributing, what you want to be connecting with people who are important to you. That's kind of the why for me, and what I try to understand from you too.
Beautiful. I think something I feel about you is that your care really honors the individual. So what you just said of like what matters to you is what matters to me. You're not going to walk into a visit, guys, with Dr. Michal and feel like, oh my God, she's going to look at my blood pressure or my cholesterol and tell me that I need to do different things. Like, it's not that at all. It's that you come in, you bring her your desires, you bring her what's hurting, you tell her what you want, and she is your partner in getting you there. And that is such a different experience than I think many people have gotten at the doctor. But Dr. Michal, you have training that's a little different than the average doc, right? You're a naturopathic doctor, which I would love for you to tell people a little bit about what that means. But you also have been a yoga teacher and you are a singer-songwriter. And so you have a very holistic approach to an interaction with a client that people might not be used to. So tell us a little bit about your background and like what informs your approach to medicine.
Yeah, and it's interesting. The question of what's a naturopathic doctor, I think, changes depending where I am and who I'm talking to. And I just want to emphasize that in certain states, there are folks who are naturopaths, who are traditional naturopaths, who can be very wonderful healers. And it's a little bit just distinct when you are working with a naturopathic doctor who's been licensed, that it's just a little bit more broader training. And Dr. Kate and Dr. Anna have also studied, as I have, and to the point where I practiced primary care medicine in Washington State for 2 years and was able to work with people in that setting. But then also just bringing in the holistic perspective, bringing in the nutrition is a big piece, and really allowing people to kind of get a sense of what is the whole picture, and where it's. I love that you mentioned those pieces of my background, where the yoga teaching, bringing mindfulness into care. And singer-songwriting, I think, is great for me because I love metaphors. I love what is a way to hear this that makes sense to you? What is language that works for you? Because sometimes the science can go over your head, or go over my head sometimes. Just that idea of like, how do I relate in a way that is meaningful?
Mhm. And that creative process. So even, I mean, doing yoga is being creative, in a way, right? Like with the movements that you're doing with your body. And like even in a visit, you're being creative. You guys are creating something during the experience of that visit and at the end of that visit that is its own work of art. And what a lot of what we look for, guys, at Sanare is that medicine is definitely a science, right? There's so much that goes into the science of medicine that's so critically important for helping people get well and stay safe. But medicine is also an art. And the interaction between a doctor and a client is also really a lot about the relationship, because you need to feel safe in order to heal, and you need to feel seen in order to feel empowered. And so I really think that you'll get that with Dr. Michal. I know that you will. In fact, Dr. Michal and I have known each other for a while. We went to medical school together with Dr. Ana Rodriguez. For those of you who know our wonderful Dr. Ana, And so if you have been getting our emails, you know that we already feel like family to each other. But importantly, I know that Dr. Michal is a very good fit for the Sanare family and will feel like family to you. So to that end, Dr. Michal, I want to walk people through, like, if somebody comes to you for the first time in a visit, what does that visit look like? Like, how long is it? What will you guys talk about? What's going to go on?
Yeah, I love starting with just download your brain. There's so much that we keep in our head and questions we have and things that just contribute to that low level anxiety that's always kind of simmering in the background for most people. And just to be able to get it out, to just talk through, these are the things, and my toe hurts and this and whatever, all the things related to your health that you have questions about, just to be able to do a brain dump and download. And I just take it in, I take notes. I'm really curious in how all these things connect. And then we start to connect the dots. We're a bit do detective work together and see, oh, that's interesting. That started at that point, and look at the timeline a little bit. And it's nice to get another set of eyes on some of this stuff. Even though you might have a hunch or have some idea, it's nice to just talk through with someone. So that's really the beginning, is really getting a sense of what's the full picture of you, and what's important to you. What are your goals? What does it look like to feel improvement, and what are things that you feel like you can't do right now and that you want to be doing, and working together to get there.
Beautiful. So, like, your story, she wants the whole story, guys, birth till now. You'll see in our intake that we ask you for that, and then you really get to drop in and bring Dr. Michal into your life even more. Who are you? What matters to you? What's bothering you? And then also your hopes and your desires. So where do you want to go? Because root cause medicine is not, it's so much about the medical detective work, yes. But it's also about designing a program that's truly a good fit for you, that will get you where you need to go. I think many of us have read books about the Mediterranean diet, or all of the workouts we're supposed to be doing and how much we're supposed to be meditating. And part of the art and the personalization of working with Dr. Michal is that she's going to help you heal in a way that will actually work and be a good fit for you and feel really nourishing and easy. And that's what that first visit is designed to do, is to create that deep connection where she knows you, and she can say, like, okay, you might tell her, I'm not going to take supplements, right? Or what are some of the things that you are listening for people to tell you about what will or will not make their plan successful?
Absolutely. And I think that's a really important point too, of am I going to need to spend a whole lot of more money doing all these other things? And that's something that I really listen and really want to have honest conversations about. I've done a lot of work in the work I've done in primary care, and working also in addiction recovery in states where I'm licensed, that I worked a lot with populations that were low income, or uh, on state insurance or that kind of thing. And so I do have a lot of strategies that also, if are what's the biggest bang for your buck, and what's free.
Mhm.
One of my favorite pieces of advice is that if you're only going to do breathing exercises or meditate for 2 minutes a day, to do it before your biggest meal. In
Oh,
that way, you get yourself in that rest and digest nervous system and help you digest your food more. And I've worked with folks who say, yeah, my stomach pain after meals got better just doing that. And so obviously there's could be a lot of other reasons why you have the stomach pain, but if you can do right, like, we're busy people, we have a lot of needs, a lot of demands on our time and our money and our energy and focus. And so what are some things that we can incorporate into what we're already doing? What are things that are going to be sustainable for us in all these ways? And I want to also say that I think Sanare is just such a great fit and a great spot. And is we're not whenever we recommend supplements or foods, we're not making any money off of that. So it's something that's very important to me, that we don't have a recommendation skewed for recommending lab testing or anything. That's not something we're making extra money on. All of this is for your best care. And so yeah, just being on the team together. I think we all since I'm on my soapbox now.
Do it.
I think it's ripple effects. I think when we feel good ourselves and that we have energy for the things that are important to us, to be creative, to do work to make the world a better place, to have the resources to look inward, to see what our blind spots are and how we treat other people, all of this has ripple effects on the world. And so by working with you all, I'm able to have even a wider reach in the fact that I'm having. So
It's
thanks for
beautiful.
coming in.
Oh
Mhm.
my God, I want to hear more. And you guys have heard me say before, Dr. Michal feels like family. She's a culture fit. And I think you just highlighted a lot of what we look for in our doctors, which is like, we're very upfront. Hey, you're not going to make a profit on supplements here. You're not going to make a profit on testing. Are you cool with that? And in fact, the docs who are perfect fit say to us, well, I was already doing that. That's really important to me because it's my integrity. I need people to know and to feel safe that I'm recommending things they truly need. I am passionate about being a good steward of people's money if that is important to them and in fact critical for most folks, right? And so already Dr. Michal had that fit for us, but she also came in saying, hey, yes, we're already on the same page about that. And I really want to do some new cool stuff at Sanare where we're doing more group programming that's more affordable for people. So you have a lot of dreams and visions for us to even make our care more accessible than it is. And that's part of what I'm so excited for you to do here over these next few months. We'll circle back once we have more details for you guys. But Dr. Michal, one of the things that struck me most when we were connecting again and hearing about what you've done over the past few years is you said that you've been doing group work. So I want to give you the space to talk about that, but I want to highlight something you said that really touched my heart. And you said, and correct me if I'm paraphrasing this wrong, but you said that one of the medicines you value most is the medicine of giving people to each other. And I went home and I thought about that. And I was like, that is the most beautiful thing I think I've heard in a very long time. Can you talk with us about, what you meant by that and what you like about the group setting?
Yes, all of that. We have an epidemic of loneliness in our culture, and it's no one individual's fault. It's the way that our society is structured and the way we're allowed to connect with each other, and how our systems and all these things are put together. And so, um, what I've really been excited about with offering kind of community care, group care, is that it's a safe space to connect with other people who are going through similar things that you're going through and to feel less alone. And there's real science behind this. I think in the next few months, I'll share some of this research where having that sense of connection has better outcomes. Not just feeling happier, but also even outcomes in terms of how you heal if you've had surgery, or how you get better if you've been sick, or if you're more motivated to make changes. So it's the research is catching up with, our intuition that yes, it feels good to be someone, not just in any group, not just kind of being in a crowd of people and with people, but feeling that you belong, feeling that I'm important here, that by my being in this group or this community, in this process, I'm benefiting other people here too. Dr. Kate and I can talk, all day long, and we do, about all of these things that we've learned and share, and even what we've seen with other people. But when you hear it from someone else in a group that you're a part of, it's so much more powerful. And when I was working specifically with addiction recovery, there's so much. It's really hard, it's really, really hard. It's really hard in any case with mental health issues to have that motivation to make change. And so what it does is it says this is going to be hard, and then the piece that groups do, what that does for me is it says this is worth it. It's seeing someone else who's done that hard work and who says, yeah, now I seen a change. And I'll share a story of one of the folks I worked with in a group who shared that she would drink when she was really overwhelmed. And she had experience where she had a really, unfortunately, I hear this so much, at the dentist, was not being treated with respect, and got to the point where she in, a few months prior would have gone home and had a drink. She practiced the breathing exercises that we would do in class, kind of that diaphragm breathing in our group each week. And she said she practiced that, and then she went home and she called the dentist's office and said, "You can't treat me like that. You need to reschedule this." And I carry that story with me just as a really tangible way of, yeah, it's hard to remember to do breathing exercises and fit this into your routine, but this is why it's worth it, because that could have been a whole different situation and could have totally upended her recovery process and all of that. So that's what I love about groups. And it's a passion of mine. At this point, nearly 20 years, I've been teaching and facilitating groups, and really just love that process and bringing people who might never ever have met each other and might be completely different identities, and how to make it into a safe space, as much a safer space. It can't always be safe, right? But to be able to have respectful conversation and learn from one another.
Mhm. I love that. It's so beautiful. And it really is also that ethos of like democratizing access to this type of healing in medicine, because with the group model, costs go down, right? So it's not one person having to pay for that whole hour and a half. It's people sharing the cost and sharing the experience, and also getting more out of it in a way, sometimes when they are able to connect with each other and have that social support component. One of the things that I wanted to have you speak a little bit about is the value of doing the working group, because so often people can come for a visit with us and we tell them all the things. And for people who have a lot of free time and they've got a lot of energy and motivation, maybe they go and they implement it right away. Other folks come back and they say, "I know you told me to do all that, but I really struggled to make it a reality." With the group model, it allows us to do things a bit differently and have people actually practice the skills we're talking about and do life together a bit more. So can you speak to that a little bit? How like the group interactions are different than one-on-one care?
Yeah, it's again, part of it is that just kind of building um, a container together a little bit. So sometimes a group process might be just drop in and come in, and sometimes it's like, okay, for the next 12 weeks, for this season, we're going to really be moving together, like doing this together. And then there's a little bit of that, like Dr. Kate said, I know that there's people out there who are super self-motivated and can just put these changes, and just do it. I'm not one of those people. I really work well having that accountability and having those folks to check in with. And also, having it be other people going through it too. It takes out, I hope that the Sanare team does not feel judgmental to you at all, or, that there's know that you can come to a visit and say, "Hey, I didn't do anything in the plan," and we'll be like, "Okay, so clearly that plan sucked. We have to make it the way it's something that you can actually do, because it's no benefit to give you a list of things that isn't going to work." So, but to have people who are just like, "Yeah, I couldn't do that either. That was really hard." Or sometimes, if it's okay to say, like, "This is something I'm really finding challenging and I need to think of a solution to it." Sometimes it's nice to just be listened to, but sometimes you want to get some tips. And so in groups, one of the things that I really love spending time on is to workshop a challenge, to just say, "Okay, here's, I want to do all these changes, all this, but I don't have time to cook this meal or whatever." And someone might be like, "Oh, I have that issue too, but you know what? I just went to the thrift shop and got a crock pot, and now I just do a big stew at the beginning of the week and I freeze it or whatever." So there's also solutions that I wouldn't even be aware of. I learned so much from working with people. Even recently, I asked someone, what was that recipe that you used?" Or, right, so it's so helpful because I can only have my experience. And so I learn from the experiences that you have, and you learn from each other too.
The medicine of each other. My favorite catchphrase of yours. I love it. So you're familiar, guys, if you're a Sanare Today client who's done IOP groups, you're familiar with this model. But what you're familiar with is therapists doing it by just with therapy. And so our hope is over the next year or so that we can integrate more of the naturopathic medicine, functional medicine, nutrition into those groups. And what I'm really thrilled about is that we have the doctor who has the expertise to do it because she has done it already. So please schedule a discovery call with Dr. Michal if you are a new patient. If you're an existing client, you can still schedule a discovery call with her. Just get to know her. You can also schedule a follow-up right now. So you can schedule a follow-up with her like you'd schedule with me or Dr. Anna or Ali. You don't have to start fresh with Dr. Michal. She's got your whole chart. She has your whole history, and you guys can just have a regular follow-up together, and she's ready to pick up right where we left off. I encourage everyone, when you see one of us, you see all of us. We are all on your team. You can see anybody at any point. So please schedule a follow-up with her today if you're needing a follow-up anyway, and get a fresh set of eyes on your case. If you've been seeing me or Dr. Anna or Ali, we have our unique lens and we've already made progress, but there are new insights that Dr. Michal will bring because she has a different life story and different training and different experience that I think would be wonderful for you to get as part of your care with this whole team. So you can do that by going to the sanaretoday.com website and clicking on the functional medicine page and clicking book appointments and select Dr. Michal. I will link some of those in the post that I'm going to send out through our newsletter. And you can get to that through my website, through the link in the description in my bio or Dr. Michal's bio. And so, Dr. Michal, anything you want to leave people with before we hang up today?
I'm super thrilled to get to know you and be able to bring this medicine to the East Coast. It's something that is available on the West Coast where we all trained, and it's really a passion of mine to make it available more widely in different parts of the country. So
Thank you. We're super grateful. You're coming back. You have Philly roots. You're coming back, which we really appreciate. All right, guys, we will be with you soon. Be well.